our Tuscany Living Lab, we have detected three important lessons learned, namely the first one, the importance of networking and communication, involving from the very beginning of your project the right stakeholders and entities bodies, so as to create with them a fruitful channel of communication and increase the impact of your actions. The second one is the importance of framework and sustainability, involving in your project some activities that can generate and create an added value along with the daily routine and daily activity of your participant, and to frame your activities in already existing initiatives. And the third one is to find a balance between general approach to health promotion and individual one.
In our Living Lab, we have the focus on people in poverty, and to make sure that we have the reference framework of poverty in every step of the process, we choose to have a collaboration with an expert in poverty. So it was somebody who had his childhood in poverty who got a training, and he now advises us in every step of the process. So he is part of our steering group, but he's also part of the actions we try to implement in reality. It's a good thing for us when we're creating interventions to make sure that we do the right thing for the right people.
In Leuven, we tried to really create a connection with our stakeholders, to invest time into getting to know their needs. We did that by personally contacting them, but we also partner up with an organization that has experience with that and is also very present in the network already, which is called SAMO, and so we work side by side realizing our Living Lab.
In Cima ao Domingo, we engage with all the stakeholders, the schools, the municipalities, the local producers in the process of decision making, and we ensure that they all on board. For that, we need to make sure we have effective communication with them. For that, we developed some strategy like frequency meetings, focus group, and seminars with them.
The Polish team is represented in the fifth project by a Living Lab, the senior daycare home in Tuszyn municipality in central Poland. We believe that elderly people are a very important vulnerable group, and eating habits can influence significantly the quality of the process of aging. We also apply very innovative and very useful intersectional approach in our Living Lab, because we believe each person consists of different components of identity, such as age and gender, socioeconomic status and education level and cultural background. That's why we advise to use intersectional approach, because it promotes social inclusion, cultural inclusion, and it takes into account different variables.
We've observed many changes in our communities. In ways, the stars have aligned for a lot of the work that's taking place in Cork. We've had a massive explosion, really, of community food growing across the city. There was always islands of innovation and projects of innovation, but in the last 3 years, there's been a huge movement around community food growing. Community is building around food. Those communities are planting food together. They're maintaining gardens and growing spaces and food setups. They're harvesting the food together, but they're also sharing the food. And through that process, they're interacting and they're engaging around the food system and discussing it and engaging in a really meaningful way. So food has gone beyond the nutritional value of food, or perhaps you might call it the food pyramid approach to food. It's the whole food system that's engaged with that community level.
In the Oxfordshire Living Lab, the thing that we found the most useful in terms of the design of the programme is working with community groups who are placed right in the centre of the most vulnerable communities. We've trained community facilitators within those groups so that they work with us on reaching our target audience and managing the programme, and we've really seen that that has been most impactful for us, working with community groups and community facilitators on the approach.
In our Living Lab, we were going to establish a food school where the children could learn how to cook good, sustainable meals, 4.5 hours, a long day where they could do it from start to finish. I was assigned the task of applying for the money to the City Council, and they gave the money, and had expected that our Department for School and Education would be very interested in participating. What I had not realized was they have so many tasks already that one extra task, even if it was free, even if transport was included, wasn't really in their interest sphere. But what happened was, once I realized this, I've tried to include them much more in the decision making and asking, what is it exactly that's the obstacle? It turns out that the transportation is really a big issue, and they were able to supply me with this knowledge, and that means that they've taken full ownership now for the food school and actually use it as a part of describing what they do for the children in Guldborgsund municipality. So the bottom line is, if you are working with certain departments in a municipal administration, you really have to be tuned into the little details of what the obstacles are, and only they know them, so you have to include them in your planning.